medication against the healthcare provider's orders, and then I'm going to check the history of the patient, make sure that there's no contraindications for a blood transfusion. And then next, I'm going to check the patient's allergies, make sure that they're not allergic to any meds, latex, or iodine, and they're not, so we're good to go there. I would make sure that a blood sample was obtained for the type and cross match. If not, I would obtain one myself. I'll gather my supplies and I'll enter the patient's room and provide privacy. Hi, my name's Jenny. I'll be your nurse today. I'm just going to be giving you some blood. Can I get your name and date of birth? Awesome. And then I make sure that I have signed consent by the patient to be able to administer the blood. Next, I'll perform hand hygiene and then put on gloves. Okay, and then next I'm gonna assess the patient. I'm just gonna look at your skin, make sure that it looks good, and then I would listen to the heart and lungs, make sure that everything sounds good. And I'd make sure that there's no other contraindications with the patient, like if they had heart failure or any kidney problems or fever or like fluid overload, something that would make it so we can't give the blood. And so he's good to go there. Everything looks good. And then I am going to start setting up my IV. And he does have IV access here and it looks good. I just look for any infiltration and we'll check for that in a minute. So I'll get my tubing out. And then I want to make sure everything is clamped. Alright, so now that I have everything clamped, I'll get my NS, and then I want to try and keep everything as clean as I can. So I'm going to take one of these caps off. The bag. Hang it up. And then I'll fill the chamber. Oh, unclamp first. I'll fill the chamber just above the filter line. Okay, so that should be good right there. Okay. And then I'm going to prime my line. Unclamp this and prime it. Okay, I'll clamp that and then put the cap back on. Make sure that it's clean. Okay. Next, I'm going to get my saline flush, alcohol swab, and I'm just going to assess the IV site, and I'm going to unclamp this, and then before flushing, I'm going to swab this for 15 seconds with alcohol. Next, I'm going to flush the line. And then I'm going to watch for any signs of infiltration while I do this. This is the point of this. And it looks good. I'm going to leave that on actually. this. Make sure there's no kinks in my line at all. Okay, I'm gonna go ahead and take this off. And then connect the IV up to the patient. Okay, so now that that's good to go, I'm going to unclamp this line, and I'm just gonna do it at a TKO rate, just to keep that open while I go get the blood. I'm just gonna slow it down a little bit, just to keep it open. It's like 20 mils an hour, so just super slow. Okay, so that's good. And while I have that going, I'm gonna go to the blood bank, take off my gloves, form hand hygiene. And then I will go to the blood bank. And then I will get the blood and do all my checks with the transfusion services. Make sure that I have the right blood for the right patient. Okay, so I'm gonna go back into the patient's room, perform hand hygiene again, and then I'll do my 2-person verification. Gloves. Okay. So first we're gonna check the name and date of birth and identification number on the patient's wristband with the blood bag. So it looks good. And then we'll check everything against the provider's orders as well. Next we're gonna check the unit number, and then we'll check the ABO, and then we'll check the RH factor. And then we will check, make sure that everything's compatible, that the blood is compatible with everything. And then we will check the transfusion identification number with the blood bag and the provider's orders, and that's good. And then we'll check the expiration date, and that's good. And then we will check the integrity of the blood, and it looks good. And I think that's it. And we are good to go. And if the expiration date was expired, I would take it back to the blood bank and get another blood. Okay, so now I am going to, before giving the blood, within 15 minutes I would need to get a full set of vital signs, just to have a baseline, and then I would assess the patient's heart and respiratory and skin as well to make sure that everything is good. Okay. Next I'm going to uncap this, spike the blood. Okay, and then I'm going to hang up the blood. Okay, and then I'm just going to prime this line. So I'm going to clamp this first, and then okay, and that is primed. And then once that is done, I'm going to, so I already got my vitals, so I'm good to go ahead and start the blood transfusion, but I just want to start it out at a really slow rate, like 60 to 120 milliliters per hour. Okay, and then once the blood gets to the patient, I want to stay with the patient for 15 minutes just to watch the patient and making sure that they don't have a transfusion reaction. If they do have a transfusion reaction, I would immediately stop the transfusion. I would assess the patient. I would get a full set of vitals. I'd notify the provider and the transfusion services. But he's not having a transfusion reaction, so we are good to go ahead and continue to administer the blood. And if he doesn't have a transfusion reaction, I would still stay with the patient for 15 minutes, and then I would get a full set of vitals and listen to the lungs and heart, and then assess the skin. And he looks good. It looks like he hasn't had any reactions, so I'm going to go ahead and speed up the transfusion according to the facility you're at. Depends how fast they want it. So I'll just speed it up. Okay. And then I'll let that run, and then periodically I'd come in and check the patient, make sure that he's doing good, making sure he doesn't have any reactions. I would get vitals every so often. And then after that, after the transfusion is done, I would go ahead and clamp the blood, clamp the line to the blood, and then I want to run the NS through the line just to flush it out. Make sure there's no more blood left in the line. So I would do that. I would unclamp the NS and have that run. And then after the NS has cleared the line, I would take another full set of vitals to compare to the baseline, making sure that the patient didn't have any other reactions. And I would also listen to the respiratory rate, heart, and then assess the skin again. Just making sure that there was nothing that I missed. And then once the line is clear, I'm good to go ahead and clean up. I would dispose of the lines in the proper place and put any of the blood, like the blood bag and the line that had any blood in it, in biohazard waste. And then after I clean up my supplies, I would assess the patient for the next 4 to 6 hours, making sure that he didn't have any delayed reaction. I'd also let the family know and the patient know what to watch for if he did, so that they could let me know and we could help him out if that happened. And now I will, after everything's cleaned up, I will lower the bed, put up the appropriate amount of side rails. Here's your call light if you need anything. I would perform hand hygiene, and I would document and just continue to watch my patient.